I'm going to just talk about sort of ideas that I have that have come to my head in the last few years and things that have just more refinement, so just sort of pieces here and there. So this is just sort of new thoughts that hopefully you can put together and build a new vision from that. I want you to take a look at this photo over a 20-year time gap. You can really see that it looks very much gravitational. But if you look at the brows, you look at the upper eyelids, the brows really haven't fallen, and the skin on the right may have come down a small bit, but on the left side it's actually retracted up a bit. So what is very obvious as we think is gravity may not be so much. If you take a narrower time gap, again, it looks gravitational, but you look very carefully under the brows and into the cheek and into the lower face, you just see a skeletonization of the face. And so the skeletonization process is subtle over a small period of time and more dramatic over a longer period of time. So I like to think of the face like a glass of water emptying. It's a way that I can communicate to my patients. So if you think about this, actually a lot of patients coming in that want volume restoration, especially women, are not necessarily enamored with their face in their very youthful time, like in the early 20s, because there's a lot of baby fat. Well, what is baby fat exactly? It's not a unique fat. All it is, it's a linear loss of fat from youth until death. And a lot of women, if you ask them when they thought they looked the best after they passed the age of 35, they often tell me around 32. It's a very interesting time period as fat continues to diminish. So using this model, I say that oftentimes we're too full in youth. And even if you want to fill it back to early 20s, they just look too full. They don't look early 20s, they just look too full. So an ideal may be somewhat a little bit older. And the yellow arrows show you how much fat to fat permanent. We're going to talk about that. It is, but there's going to be ongoing loss. So I like to sort of understand the big picture of just sort of seeing how we see aging. We've heard a little about this earlier, and this is my take on it. As youth, we see a circle. We almost immediately recognize a facial shape from a distance of 20 to 30 feet away. As we continue, we still have that circle maintained in the teenage years based on the idea of baby fat. It continues into the early 20s, and then as we move forward, there's a slight progression of just hollowing into the buccal zone, and that becomes more articulated as we get into the late 20s and into a period of time that I think a lot of women actually like, which is early to mid-30s if you ask them to bring their old photos in. As they proceed in time, there's a squaring off where the lower face begins to dominate, and that becomes further accentuated in the lower face where you start to see continued volume loss in the upper face. So as we get hollower and hollower, there's an inversion of the triangle. So a simple algorithm is just to look at this of saying, well, we're just wanting to try to reverse that triangle. One of them is, in my opinion, is trying to soften transition points and seeing the face more as an oval. And the thing I want you to sort of see is how people see themselves and how you see them is oftentimes from the frontal view, which to me is the most important one. So creating ovals and really establishing facial balance. What does that mean? This example is a woman, looks like she's had cheek implants, she just has very large cheeks, and so the goal here is to soften out the outer cheek by blending it into the front cheek and into the buccal area, and that allows the face to assume a more oval shape from the frontal view. This is a lady that has a relatively fuller buccal area, and I didn't put much in the buccal zone, but the chin and the central cheek area, of course, around the eye as well. She also had a conservative upper left, and she had plasma skin resurfacing. And you can see that it helps bring that into a better oval. This is a very wide Asian face, and I'm sorry she's smiling a little bit on the after photo, but you can see that by bringing the volume to the central cheek and around the lower jawline, you actually create facial balance. I always like to say, if you think of what balance is, it's just, if you think of a glass of water on a television screen, you really have no relationship to what that means in terms of size. You put a shot glass next to it, it looks big. You put a big pitcher of water next to it, it looks small. So this is the idea of trying to store balance. Longevity, does fat last? This is obviously a huge question. And I really think it does, and I do a lot of hair restoration in my practice, and that's really changed the way that I view fat grafting. So I looked at, when I was studying for the hair boards, I was looking at Unger's book, and I was looking at, oh wow, wait a second, hair transplants, of course they don't grow in 5 days, we don't expect it to be there, but why do we expect fat to be there at 2 months? Well, I really think that the model of understanding hair restoration helps me understand fat better. I see that there's this neovascularization, and fat improves from 6 months to about 18 months, just like a hair transplant. So this is how I help patients understand our rocky relationship, I call it. Early on, too much swelling, and it reaches a point of very, very nice results about a month, but that's obviously artifactual because you're getting some swelling and stretching of the skin and everything looks a little bit better. At 3 months, oftentimes there's a great temptation to do a touch-up. My opinion, this is the nadir when the fat cells may be crenating a little bit, but haven't really achieved that robust blood supply that occurs over time. Then obviously after 18 months to 2 years, there's a little bit of further aging that goes on. So this is sequential. I've got a couple cases to show this, but on my website I've got many more if you're interested in looking at it. This is a week out, puffy, bruised, and swollen. And at a month, maybe a little bit too full, but maybe not bad. At 3 months, this is an example of maybe not much of a dip. And if you see, maybe she's actually dipping a little bit longer out, about 6 months out. And this is what I like to show you as two extremes. A person that really didn't dip much and a person that dipped a lot. And so there's a variability at that 3-month level. As we go forward into the 11th month phase, you can all of a sudden see it start to pick up again, and you're wondering what's going on here. And it's just really just taking sequential photographs and following your patient carefully. And I think we're reaching an endpoint somewhere the 15 months to two-year phase. This is a lady a little bit younger, 40, the last one was close to 50. If you see her here about a week, I put less fat, so there's less swelling, there's less bruising, and maybe that's sometimes why there's an earlier dip, and maybe that's why there's more of a pronounced dip. So at 3 months, you can see that this is not a remarkable photograph, but it's still, if you look at, I always say, if you had lunch with the lady on the right and the lady on the left, you wouldn't think they looked much different. But at about a year out, there's a nice fullness, there's a nice, the way that the light arcs across the face is better. This is very controlled photography in the same room, but there is more light. And this is how I try to sell predictability, which we'll talk about more at the panel. If you look at her on the right, even though the tear trough is not perfect, the way you relate to her emotionally is very different. So when do you use an implant? When do you use fat? Well, I'm a big proponent of fat, as you know, but I like to understand the idea of like versus like. So if we go back to the initial slide of fat loss, we start to think about it and say that we actually have more soft tissue in youth than hard tissue, and we lose a greater degree of soft tissue to hard tissue loss with better dental care, etc. So if we lose more soft tissue than hard tissue as we age, and we put an implant in, we actually create a smaller differential between the two, and I think there can be exposure of implants, particularly cheek implants, what I'm talking about. With aging, we go back to that model again, and if you use fat, you increase that differential, and it allows you to soften transition points. So I think that's a really strong emphasis that I want to point out. So you cover exposed bone, I think that looks more youthful, and again, you can see the boniness of an older face. So facial transitions, basically I really believe implants in probably the wrong hands. Obviously you get someone like Dr. Torino who can do great work. There's no question he can get great results. For my hands, I see that implants actually accentuate transition points, and fat grafting decreases transition points. So I just want you to think about like replacing like. Here's an example of a gentleman that I think he just needs a chin implant and a little liposuction in the neck, and it's not a bad result. So this is the book, small plug there. And I know it's late, but I got a hair restoration course next week I'm very proud of in St. Louis, if you can join me. If you have any questions, I'd be welcome to entertain them. This is my email. Thank you very much.